code first rule, you definitely will have to get besides the one that you're looking at. And then, if applicable, a causal condition first, that one, it only applies if it is, okay?
Just a little.
Just a little, it's okay, you'll get it. Code first, you code that condition first, and then code, if applicable, you take it, by its meaning, you only code it if it applies.
If it's a woman that has retention of urine, you wouldn't code the enlarged prostate because she's a, okay, that makes sense.
There you
I
go.
know she's a trans woman.
Well, yeah.
Oh, yeah, but again, it just depends on your documentation. Alright, moving on, code also, you have your code also, again, it just means that two codes may be required. Then you have your indiscriminate multiple coding. Your indiscriminate multiple coding rules identify when multiple codes should or should not occur, okay? You have that one, let's see what else we have. We have our cross references, so our and, our with, our connecting words as well. So, one of the examples that I gave last time is diabetes, diabetes with, retinopathy. If you go to the diabetes section, let's look at, page 103. Okay, under your diabetes main term. Let's say your doctor is listing the patient's conditions: diabetes, hypertension, hypercholesterol, dry eye syndrome, and whatever else the patient has, right? Oh, and retinopathy. Because we have the rule of the with, I'm gonna skip to the with one. So if you look at page 103, diabetes with, and then you have all of these conditions. Amyotrophy, arthropathy, autonomic, cataract, all that good stuff. So if your documentation supports any of the conditions that follow under with, you make the automatic assumption that they're related. If they do not, if the doctor puts diabetes, no complications, but then they put retinopathy, then they're making that distinction that it's not related, okay? So with the diabetes with retinopathy, we're gonna go with retinopathy, and you have your default code E11319, and then you have all these wonderful specificity if they do have it. So again, because we have that with rule on page 32, again, it makes that assumption that they are related unless the documentation tells us otherwise, okay? The same kind of goes for and. There you have the term and is interpreted to mean and or when it appears in a code title. The term and means the patient may have one or the other of the statements included in the code title. There you have the example of Z51.1. Encounter for anti-neoplastic chemotherapy and immunotherapy. The patient may come in for just chemotherapy, but again, because we have the and or the or, we can still apply it, okay? We have our connecting words: associated with, complicated by, due to, during, following, secondary to, with mention of, without. Connecting words or connecting terms are subterms in the alphabetic index that appear after the main term to indicate a relationship between the main term and the associated condition or etiology. So again, just depending on the condition, like the diabetes one, if the doctor doesn't literally tell you diabetes is alone, retinopathy is alone, or if they tell you diabetes with retinopathy, it'll change the code that you are looking for, okay? And then we have our general coding guidelines. It'll tell you about locating the code, the level of detail. You have certain guidelines for signs and symptoms, conditions that are integral to a disease process. Some of these examples are just depend on what you end up coding at the end of the day. For example, for the signs and symptoms, there on page 35, it'll tell you there is a guideline. Where is it?
Chapter 18.
Yeah, that's the chapter for the signs and symptoms, but there is a guideline in our ICD-10 guidelines that include the signs and symptoms. So, the example I used last time is if you have, let's say, an upper respiratory infection, but the doctor also documented the runny nose, the coughing, the fever, all of that stuff. If the doctor confirms the condition, but they also document the symptoms, because the doctor confirmed the upper respiratory infection, we cannot pick up the signs or If he put something else unrelated, let's say he put, I don't know, let's say he put something about asbestos, but then the runny nose and the, fever were part of something else. But he made that distinction in the notes, then we can pick up the signs and symptoms. It just clearly depends on what they're talking, okay? That's just an example for the signs and symptoms. Conditions that are integral part of a disease process, so that's another guideline that we have, and then we also have conditions that are not an integral part of the disease process. So again, that kind of falls into the signs and symptoms kind of thing, but, a great example I can give you is with radiculopathy. So let's say we have radiculopathy of the neck, that's the confirmed condition, but then the doctor also documents neck pain. Because it is related to the radiculopathy, you don't pick up the neck pain. Does that make sense? Let's say the doctor wrote, okay, patient has radiculopathy of the neck, but then they wrote, neck pain due to motor vehicle accident.
Oh,
Okay, if we make that distinction, then the neck pain, we code the neck pain and the radiculopathy. But again, if the neck pain was related to the radiculopathy, we don't pick it, okay? So that's just a couple of the guidelines as well. Acute and chronic conditions, this is a good one as well. Anytime you have acute or chronic, it is also part of the guidelines we'll talk about for the chapter 3. But here in this instance, we have acute and chronic conditions. If a patient has both the acute form and the chronic form of a disease, the coder must identify in the index if there are separate entries on the same indentation level. If there are two separate lines in the index for acute and chronic, then you code both, okay? If there are separate lines for acute and chronic, you code both. So for example, pancreatitis, you have acute, K85.90, pancreatitis chronic, you have K86.1, okay? For that instance, you would code the acute code first and the chronic code after, okay? So if the doctor documents acute on chronic pancreatitis, how many codes are you gonna have?
2.
Two, correct, yes. If they just document chronic pancreatitis, what are you gonna code?
Just 1.
Just one, okay? So there are certain conditions that have, individual lines for acute or chronic, not all of them do. But that is one of the rules as well regarding acute and chronic. Let's see, combination codes, you will have some combo codes. That essentially means that you have, you require an additional code. They have here the example, a patient may have acute bronchitis with bronchiectasis and tobacco use. 2 codes would be required, J47, a combo code for bronchiectasis and acute bronchitis, and Z7 2.0, the code for tobacco use, okay? So just depending on what they are actually documenting, you may need more than one code, okay? Sequela and late effects, these are fun, okay, but I'll just kind of briefly go through these. Here you have sequela, page 38 in your workbook, a condition that is produced by another illness or an injury and remains after the acute phase of the illness or injury is referred to as a sequela, okay? This is, for example, I think they use the SCAR one, if you look on page 39. A physician documents the following conditions: scar of the skin on the face due to previous third-degree burns of the face. The coder must recognize the condition present today is the scar, and the cause of the scar was a previous third-degree burn to the face. So here it gives you step-by-step. The coder assesses the term scar, you go to the index, you end up with scarring, see also cicatrix, L90.5, cicatrix, skin, L90.5. Then the coder must confirm in the tabular L90.5. You don't have any other instructions, you don't have any anatomic locations or anything else. Then you translate the fact of the word sequela to identify the burn. So you're gonna go sequela, burn, and then you see code to injury with 7-character S. This is when you start seeing that 7-character S. Then you have burn face, C, burn head, and then you have burn head 3rd degree, T 20.30. Again, that's your default code. You're gonna go to your alphabetic, and you go to, your tabular, and then you go to, the coder must assess the tabular to review the entry T 20.30 to determine if more characters are required. There you determine that the 7th character of S for sequela, therefore a placeholder character of X is needed in the 6th position, okay? then after following these steps, the coder concludes that all the coding for the scar of the skin of the face due to previous third-degree burns is coded as L90.5 and T20.30XF. So again, it just clearly depends on what the doctor is documenting, okay? The sequelas, get a little tricky, but they're not too complicated, okay? Let's see, impending or threatened condition. Here, what is the example that they use? I'm trying to think of one. Okay, so this one, so this particular one applies to inpatient. I know for outpatient it does differentiate a little bit more. But for the sake of this chapter, there you have, if a condition described at the time of discharge is impending or threatened, it should be coded as follows. If the condition did occur, coded as confirmed. If the condition did not occur, reference to the alphabetic index, determine if there is a sub-entry for impending or threatened, and then kind of go from there. They're requiring the same diagnosis but more than once. Again, laterality, always make sure you are looking for laterality, especially if you are dealing with musculoskeletal, whether it's pain, the injury, what else is there? The shoulder one is a great example. Part of our guidelines as well is documentation by clinicians other than the patient's provider. A great example I can give you for this one is, let's say the doctor has the diagnosis of diabetes, hypertension, hypercholesterol, then they put obesity, okay? One of the codes that goes along with obesity is your BMI code, okay? So you're gonna code your obesity and you're gonna code your BMI. For example, the doctor didn't document the BMI on their note. Because they didn't do it, you can still reference the nurse's note. You can reference the nurse's vital signs if she or he indeed document the BMI. So this is telling you again, documentation by clinicians other than the patient provider, you can refer to, again, depending on the situation. Then we have syndromes, documentation, complications of care, borderline diagnosis. This is another good one, page 42. Borderline diagnosis. When the physician uses the adjective of borderline with the diagnosis, the coder must consider the meaning of the word borderline by the physician. If a physician documents a borderline diagnosis, the physician is likely to mean that the patient has a condition, but possibly a milder form, okay? One of the examples that they give you here is the borderline personality disorder. You also see borderline diabetes, especially a lot down here. So again, it just depends on the term. You may have the entry for the borderline, you may not. Let's see what else. All right, okay. Moving on to page 43, you have your basic steps of ICD-10 coding, and that is the end of chapter 1. I know it was a lot, but we got the basis of it down, right?
Sure.
In theory. In theory, okay.
Sure.
Okay. Right. We have, okay, so I'm gonna move on to chapter 2 for the sake of time. And again, I know we said you're gonna try to do your assignments as soon as you can. You do have your deadlines, but do not wait for that deadline to do it, because if not, you will be overwhelmed, okay? Let me see here. Alright, so chapter 2 is your PCS. This is gonna be your yellow book, your PCS book, okay? This one is different in that the PCS is procedural coding, okay? The other book is diagnosis coding, okay? Procedural coding is a little bit different. It mainly applies to inpatient coding. You'll end up finding out the difference between inpatient coding and outpatient coding. Inpatient is obviously if you're staying in the hospital for a week, you're gonna see these codes in those types of encounters. If you only go for a same-day service, you're gonna see your ambulatory or CPT codes for those encounters. So there are 2 different types of procedure coding. This one is your PCS is one, and then your ambulatory outpatient is another, okay? But for this class, we're gonna talk about PCS, okay? Chapter 2. All right. We have our intro to ICD-10 PCS, which is your procedure coding system, okay? ICD-10 CM is your diagnosis, PCS is your procedure coding system, okay? Developed under contract by CMS, codes for inpatient procedures, okay? Remember that ICD-10 PCS is inpatient. Which one was outpatient? CBD, correct. Alright, you have for PCS, multi-axial 7-character alphanumeric code structure. You also have unique codes for different types of procedures. This was developed exclusively for the US. It was initially released in '98, and the last update was in October 2021. Alright, so PCS is a little bit different, because again, we are talking about procedures. We have 4 attributes for PCS. You have completeness, expandability, multi-axial, and you have standard terminology. If you look at completeness, a unique code for all substantially different procedures. Expandability, allow code for new procedures to be easily identified. And multi-axial, which are your independent characters to describe the procedure. And you have your standardized terminology. Each term has a specific meaning or definition. If you look on page 48 of your workbook, you have again those same components there. Your development of ICD-10 PCS, completeness, expandability, multi-axial, and your standard terminology. Page 48, 49 in your workbook. Alright, your 4 principles of PCS development. No diagnosis or reason for the procedure is included in the PCS code description. So remember, PCS deals nothing with the diagnosis, okay? It is strictly the procedure. Here they also have limit the not otherwise specified codes whenever available. And it also tells you limit the use of NEC codes or other specified types of codes. And we also have the system allows for all procedures to be coded with ICD-10 PCS. So again, first principle is no diagnosis or reason for the procedure is included in the description. And then we have our second principle to limit NOS. We have our third one to limit NEC. And then we have our fourth one, the system allows all procedures to be coded with ICD-10 PCS. On page 50, you have table 2.1. You have the characteristics of ICD-10 PCS codes. Do I have these here? Okay, so we have, again, the overall attributes, which include those 4 pillars, the completeness, expandability, multi-axial, standard term. Our development principles, which has the no diagnostic information. We are limiting NOS and NEC codes, and we obviously have the specificity. We have that the codes are alphanumeric. Again, PCS also uses 7 characters. We use digits 0 through 9, and letters A through H, J through N, and P through Z. And then we have the consistency in PCS characteristics, which are all 7 characters long. So there's a big difference between diagnosis and PCS. Your PCS will always have 7 characters, okay? Always have 7 characters. Here again, codes are constructed using the alphabetic index and the code table, okay? If you want to open up your PCS book, you can see the difference here. You have your alphabetic there as well. And then you'll have your tables at the back. Look a little bit different, okay? So again, these are will always have 7 characters, and if you go to your random, let's see, if you go to page 894, 894, sorry. This is your medical and surgical bursa and ligaments table. If you look at it there, you have all of these potential codes, your potential characters for your code. So, for example, for this section, we start off with the for medical and surgical. Then our second character is M for the bursa and ligaments. And then our third character is the repair. Okay, restoring to the extent possible a body part to its normal anatomic structure and function. But depending on the actual procedure that is being done, your 4th character may be any of these characters. Your 5th character may be any of those approaches. Your 6th character means that there is no device, and your qualifier means that there is no qualifier. So, for example, you have 0M2 if it definitely is the shoulder of the left. You're going to have 0MQ 2, and let's say it was open, you're gonna have 0MQ20ZZ, and you get that code right there. So, again, this one's a little bit different, okay? It's nothing too complicated, but again, we also have the same guidelines. These will have their own guidelines to follow as well, okay? Again, we said 7 characters in length, composed of letters and numbers called values. Each of the 7 digits or letters are called characters. Each value is a specific option for each character. Okay. Alright, so each character has 1 to 34 possible values. A value can be a number from 0 to 9. A value can be a letter from A through H, J through M, and P through Z. The alphabetic letters of O and I are not used, okay? They are not used, so you won't be confused with the 0 and the 1. Always remember that you won't find a PCS code that has O's and I's, only 0s and 1s, okay? Code structure. Each code is constructed by choosing a specific value for each of the 7 characters. Values are assigned to each character, specifying the section, body system, root operation, body part, approach, device, and qualifier. So if you look back to where we were, you can see all of those elements in your tables there as well, okay? The definition of each character is a function of its physical position in the code, the same value placed in a different position meaning something different. Okay. Alright, so here we have our 7 characters, alphanumeric. The first one is the section of your PCS book, okay? That's your first character. Your second character is your body system, okay? Your third character is the root operation. The fourth one is your body part. Your fifth character is the approach. Your sixth character is your device. And your seventh is your qualifier, okay? So this is how the PCS codes differ again from your diagnosis codes. These have separate values for each of the characters. Section, body system, root operation, body part, approach, device, and qualifier. Okay. So here we have again, the index provides an alphabetic listing of the procedure titles, root operation, body parts, devices. Codes can be found in the index based on the root operation term, okay? Right now we'll be able to talk about the root operation term because it's a little bit different. Then we have index entries exist for common procedure titles, and then our main term in the index may specify the first 3 or 4 characters, okay? So let's go to, see if we can find an example. Okay, so we're gonna use the appendectomy example on page 53. So let's go to appendectomy in your PCS book. This is your yellow one, your PCS book.
It says C drainage.
Of course, this one.
C drainage, appendix, 0B, 9.
Okay. Well, you're looking at appendicotomy.
Oh, I
You're
did.
looking for appendectomy.
No, I did, appendectomy. C drainage, appendix.
Look at the difference. Go up a little bit. You see, this is where our medical
Yeah.
term comes in handy, okay? The ectomy versus the ichthyotomy, that's different, okay? So here we have appendectomy on page 2 of your PCS book. You have different C instructions. C, excision appendix, then you have your ODBJ, or C, resection, appendix ODTJ. So you see the difference there already? You said that the third one, let's go back up here. Our third one depends on the root operation. So there are 2 different root operations, are either excision or resection, okay? So depending on what actually transpired during the surgery will determine if we go the excision route or the resection route. So now you're asking, well, how do we determine the difference between the root operations? Great question. If you go to, where is it? I know there is a table. If you look on page 60 in your workbook, you have table 2.6, your 9 groups of root operation. okay? So again, if we reference back to our appendectomy, it said either excision or resection. Let's look for excision or resection. So here it tells you the root operation, what the operation does, the objective of the procedure, procedure site, and an example. So we have excision, which is your B value. Excision means to take out some or all of the body part, and the objective is to cut out or off without replacing. And then here we have the procedure site, sum of body part, and an example would be a breast lumpectomy, okay? So that was one of our root operations. The other one was resection. Let's look at resection. Resection is your T value. Takes out some or all of the body part, cutting out or off without replacement. You see the difference here? All of a body part versus excision, which is some of a body part. You see that? And then here the example would be a total mastectomy. So do you see the difference between an excision and a resection?
Yes.
Okay, so again, depending on what actually transpired during the surgery, you'll be able to determine which route you go, okay? So for example, let's say it was an appendectomy resection, okay? So let's go to C resection appendix ODTJ, okay? Let's see what we find there. ODT, let me go this way. What do we find? Okay, so if you go to resection appendix, you have the same one, ODTJ, okay, so let's go to ODTJ. Looks like a tongue twister. ODT.
It's on page 691.
We're going to the systems tables first.
Monday?
We're going to the system tables first.
So, yeah, so for example, so like this one that we went to, it said appendectomy C resection. If you go to resection in your alphabetic index, you still get the same thing. So resection, appendix, you get the ODTJ. So now we're going to essentially our tabular, the back section, which we said 691, right?
Yes, ma'am.
ODTJ, let's go to ODTJ.
In the middle section.
Yeah, so you see all of these, ODTJ 4ZG, you get percutaneous endoscopic, hand assisted, percutaneous endoscopic, by a natural or artificial opening, and if you go to, we should be able to find our table here.
First, the table is in 642.
642? 674? Sorry. We're looking at our table 642, we said ODT, there we go, medical surgical, GI, resection, and then we have our body part of appendix, J, okay? So we have J, then is it a natural or artificial opening? Is it a percutaneous? Is it, so you see how, again, depending on what actually went, you'll be able to determine what your final code is. So for example, let's say it was the percutaneous endoscopic and it was hand assisted. So we're gonna end up with ODTJ for ZG, right? Okay, did we get how we got there? Okay. Is that a or? Yes? Okay. So again, these are a little bit different. Again, these are for inpatient procedures. So if you are in that position to code inpatient procedures, this is what you will deal with, okay?
I feel like this chapter is gonna help us with our thinking class.
Oh, see?
Yeah, because it's PCS and I've been a little lost.
Oh, okay. Okay, well, we're getting there. We're catching up.
Why is it 4 on the approach number 5?
So that one, so do you see the difference between, that first section, the body parts, you don't have the appendix in the body part?
Yeah, it's J.
But if you look at the second section, you have large intestine right appendix, large intestine right appendix. So you only go to the section where you have your body part. So that first section doesn't have appendix. If you look at it, esophagus, esophageal gastric, esophagus, stomach, small intestine, duodenum, jejunum, ileum, ileocecal valve, large intestine, cecum, ascending colon, rectum, and anus. You do not have appendix in there. So that particular section of the table won't apply.
No, I mean on number 5, approach 5, you said it was 4. What was that?
Oh, 4 for the percutaneous endoscopic. So that, depending on the, procedure that you're doing, let's say it definitely was a percutaneous endoscopic approach, you would use that one.
Oh, okay.
Yeah, so you have your body part, which is your 4th, your approach, which is your 5th, your device, which is 6th, and your qualifier, which is 7th, which we have up here. Your section, your body system, root, body part, approach, device, or qualifier, okay? Okay. Moving on, alright. Again, your index provides an alphabetic listing of procedure titles, root operations, okay? Index entries must exist for common procedures, we talked about that. Okay, here's where we talk about the table. Each table identifies the first 3 characters of the code. The table is used to obtain the complete code by specifying the last 4 characters, which again are your body part, approach, device, and qualifier. Each table is composed of rows that specify the valid combination of code values. Characters 4, 5, 6, and 7 must be chosen from the same row, okay? Does that make sense? So anytime you are in your tables, you have to choose from that same row. You can't kind of just like, pick from one to the next, okay? Alright, here's the example that we use. Procedures, this one is open appendix. Okay, so this one, it tells us to go to either excision and resection. The coder, again, must know the definition of the 2 entries to select the correct table. So again, one thing that if you do end up doing inpatient is you don't really have to memorize your table of root operations, but you have to make sure you know the distinction between all of those root operations, okay? So again, excision and resection, we said the difference was what excision is some of the body part and resection is all of the body part, okay? So here we have appendectomy is a resection. It is the removal of the entire body part of the appendix. So here it's telling us to go to resection, okay? Here it tells us to access 0DT, resection appendix, then we have the 4 columns. Okay, for this example, it went open, appendix open, no device, no qualifier. So we ended up with ODT, let's go to
J0,
J0, ZZ.
Z.
There you go, see? Yeah, you guys are coding, see? Alright, each of the 7 characters have a defined meaning. Again, your character 1 is your section. The first character determines a broad category or section, such as medical, surgical, and they begin with 0. Your character 2 is your body system, defines the body system, which is the general physiological system or anatomic region involved. Character 3 is your root operation, the objective of the procedure being done. Character 4 is your body part, the body part of the specific anatomical site where the procedure is performed. Character 5 is your approach, the technique used to reach the operative site. Character 6, your device. Depending on the procedure, there may or may not be a device left in place at the end of the procedure. So this is where this comes in, the device. If there is a device left at the end of the procedure. Character 7 is your qualifier, is defined for a particular code and additional attributes for the procedure. Alright, so again, keep in mind table 2.6 on page 60 through 62, okay? Again, you do not have to memorize all of your root operations, but please make sure you understand the difference between all of them. Again, you have the root operations that take out some or all, operations that take out solids or fluids or gases, root operations that involve cutting and separation only. You have root operations that put in or put back, move some or all of a body part, and so on and so forth. Okay, so again, please make sure whenever you are PCS coding, you are able to determine which root operation you're going through. Alright. If you look on page 66, 67 in your workbook, you have some examples of the procedures. Figure 2.2, you have the comparison of an open and percutaneous endoscopic approach. Open obviously means that they are opening the body, okay? Percutaneous means that they're going under the skin or through the skin. You can see the actual difference there versus an open cholecystectomy and laparoscopic cholecystectomy, okay? These are in particular to the approach. Remember we said we have our approach, which is the, let's go back up here. Our approach is, what did we say? Character 5, correct. So those are examples of the approaches. You also have table 2.8, which talks about the 7 approaches and the definition. Again, you do not have to memorize these, but please make sure you understand the difference between each of them. You have open, percutaneous endoscopic, natural or artificial opening, natural or artificial opening endoscopic, natural or artificial opening endoscopic with percutaneous endoscopic assistance, and external. So these are a little bit more crazy than our diagnosis. But they are just this one. Alright, you also have your approaches, figure 2.2, figure 2.4, your percutaneous approach. Then you have your approach via natural or artificial opening, which is through through your mouth to your trachea, your endotracheal intubation. You also have your approach via natural or artificial opening. There you have that example. Figure 2.6, again your natural or artificial opening with percutaneous endoscopic, and then you have your external approach. So again, like I said, do not memorize them, but understand the difference between them. Alright. Trying to get through this as much as we can, guys. I know it's a lot. Alright, PCS is composed of 16 sections and section values, again using numbers 0 through 9, letters B through D, and letters F through H and X. 17 sections contained within 3 main sections. You have your medical surgical section, your medical surgical related section, and you have your ancillary section. Excuse me. Your first section, which is your medical and surgical section, contains the majority of procedures typically performed in an inpatient setting. This is where we have the first character of a 0. All procedures begin with the section value of 0. Our second section, which is our medical and surgical related section, includes procedures such as obstructives, obstetrics, placement, administration, measuring, monitoring, and so on and so forth. All procedures begin with a section value of 1 through 9. So do you see the difference there for a second? All procedures begin with a 0, and then for here, all procedures begin with a section value of 1 through 9. Your third section, which is your ancillary section, includes imaging, nuclear medicine, radiation, so on and so forth. All procedures begin with a section value of B through D, and F through H, and X, which are your letters. Alright, so here we have your first character, your medical surgical section, which is 0. Your second character, your body system. We have 31 body systems identified. Some customary body systems have multiple body system values. For example, circulatory and musculoskeletal have multiple values. Okay. And then we have our third character, our root operations. Again, these are your that table that we were referencing are 31 root operations. You can memorize all of them. Our fourth character is our body part. Fifth character is approach. Sixth character is device. Again, we said, and seventh character is our qualifier. In particular to the qualifier, it is used with certain procedures to define an additional attribute. Unique values for individual procedures are needed. For example, identifying the destination in a finance. Our root operation is our third character. Each component of the procedure is defined separately. Again, we analyze the up report to identify the objective of the procedure. Procedure coded is a procedure performed. If an intended procedure is changed or discontinued, the root operation is based on the actual procedure performed. Okay. If an intended procedure is is changed or discontinued, the route operation is based on the actual procedure performed. If multiple procedures are performed that are defined by distinct objectives during one single operative episode, then multiple procedure codes are used. For example, obtaining a vein graft used for coronary artery bypass surgery is coded as a separate procedure from the bypass itself. Multiple procedures are coded if the same root operation is performed on different body parts that have distinct body part values. For example, a biopsy or diagnostic excision is performed on the duodenum and the. Alright, so I'm gonna stop here and I'm gonna quickly go over your assignments for chapter 2, okay? Just so we can all be on the same page, okay? We stopped here. 29, it's like, let us go to our module 4 week. Then you have your module overview, your lecture readings, which are the slides we just went over. You do have your PCS official guidelines. You can look at those as well to see the difference between the diagnosis versus the procedure ones. All right, for assignment number 1, chapter 2, you will have multiple attempts. Again, you will have time to do those. So this one is telling you to reference table 2.6, the 9 groups of root operations, okay? So keep that page handy, table 2.6, you're gonna have to match, okay? You're gonna match. And you're gonna be given your excision, resection, detachment, destruction. You're gonna give you your root operation, you're gonna have to match it. So for the first one, table 2.6. Table 2.6, this is assignment number 1. And your table 2.6 is in your workbook. I'll put that on there. We'll do it right now. You will have multiple attempts as well, so again, just be mindful whenever you are doing them. And as well as
That's what's on page 60.
yes, page 60 through 62. Okay, using workbook table 2.6. Page numbers.
60 to 62.
So that's your first assignment for chapter 2, okay? So again, you're gonna match your root operations, okay? This is again where I say don't memorize them, but make sure you understand the difference, okay? For your number 2 assignment, it is gonna be the continuation of your root operations, okay? So there's just more on the root operations. Let me change this one as well, using workbook table 2.6. Pages 60 to 60. Okay? So remember that table 2.6 is gonna be your best friend for these assignments. Alright, so for assignment number 3, you're gonna look at the approaches. Your approaches. Which we talked about on table 2.8. Okay? 2.8. You're gonna use reference 2.8 for your number 3 assignment. Page 65? Page 65 is none. Okay, when I say workbook, it means this one, okay? Letting you guys know, page 65. You also have a review exercise, which you will be coding, okay? Your review exercise you will code, okay? You're gonna be giving me your PCS code, okay? PCS code, which is your yellow one, your yellow book. Okay,
Is that one 10 questions or what have you?
this is 100, just because you asked. Just kidding, guys, it's only 10 questions. But don't let the number of questions deceive you, okay? Again, you have multiple attempts, you will have 60 minutes for each attempt, okay? For this one, you are just giving me just the code, okay? Remember, don't get your zeros and ones confused, or only your your O's and your I's confused. We're only using zeros and ones, okay? That's for your, chapter 2 review exercise, okay? For your quiz number 2, this is your quiz for chapter 2. Okay, you will talk about, again, the difference between your characters, which are what does the first character respond to, what does the second one respond to, so on and so forth.
So it covers the PowerPoint?
Yes, your quiz will cover your PowerPoint, and you will also be not coding. You won't be coding anymore. And your quiz won't be coding, so your quiz will be over the book and the PowerPoint. Okay, so again, for your quiz, remember again which character stands for what, okay? Your first character stands for your section, which one stands for body system, root operation, body part, okay? That one we said we can refer to page 51, correct. Another one right here. Oh, yes, you're right. Figure 2.1, yeah, figure 2.1, remember those. Remember how we talked about when we're coding, we stay on the row of the table, okay? We don't go to the different rows, we stay straight across, right? Okay. More, let me find it really quickly. Okay, make sure you know, where or what your main terms stand for, which in this case, because we are looking at procedures, what type of main term are we looking at? Is it an objective? Is it descriptive? Is it a noun? Is it an action? So on and so forth. Again, also look at the 4 pillars of the PCS, which we talked about on, page 48, your completeness, expandability, your multi-axial, and your standard terminology. Okay, page 48, yes. Your development of the PCS, completeness, expandability, multi-axial, and standard terminology.
And this is just for the quiz, or?
This is just for the quiz. Yes. Let's see. Understand that again, we're using our alphabetic index and our code tables. Okay, our code tables are PCS, your ICD-10-CM is alphabetic index and your tabular. Okay, so understand the difference. PCS is alpha index and your code table. Okay, understand that the values and the characters are again also correspond to your section, your body system, root operation, body parts, approach, device, and qualifier. Understand again the same thing, which character is part of your PCS. So your PCS codes have your body system, root operation, body part, approach, all that good stuff. Let me change that. So the same way that we verify in ICD-10-CM, we also verify in PCS. Remember, we don't just look at just the default code that we get, we have to go through our tables to confirm it, right?
Mm-hmm.
Okay. Again, understand the section, body systems, root operation, what do they actually stand for? So like the root operation is the procedure being, the objective of the procedure. Your body system is the general physiological system or anatomical region involved. And the same goes for all of the sections, body systems, root operation, body part. Also understand some of, which operations fall under root operations, so using again the table again, you'll be able to tell me, okay, excision is a root operation that takes out some or all of it, resection takes out some or all of it, detachment, destruction, extraction, so on and so forth. Make sure you understand the general, we're gonna tell you, the general, what's a good word?
The gist of it?
Yeah, understand the gist of each section, so root operation to take out some or all, versus take out solids, fluids, versus cutting and separating only. Your quiz will look at those root operations. It'll also look at the ones involving a device.
I think that one, it's page 2.8, right? The open, oh no.
2.8,
No, 2.6 is
Oh.
excision and resection.
Page
Mhm.
60.
Yes, so again, that's gonna be a good best friend for your quiz. Understand the definition of open approach. What is the actual definition? Let's see. What do we have?
2.8.
Yes, there we go. Cutting through the skin, membrane, and any other body layers necessary to expose the site of the procedure. Understand the same for all of those. So table 2.8 is your best friend too. Alright. Do I have any questions regarding chapter 1 and chapter 2? Okay. Your chapter 1 exam is due on the 24th, okay? It's due on the 24th, excuse me. Do not wait until the 24th to do it, cause then you're gonna feel overwhelmed. So again, if you can finish all of chapter 1 today, go for it. If you can finish all of chapter 2 this, weekend, go for it. If you can add on to your chapter 1 exam, go for it, okay? Do not wait. Excuse me, I don't want you to feel overwhelmed with all of the assignments, quizzes, and the exam we have. Chapter 1 exam, this is your first exam, okay? You will not do an exam for chapter 2, okay? You're only doing an exam for chapter 1, chapter 3, and I have to say chapter 4 if I'm not mistaken, but I'll confirm. Again, you do have multiple exams, you will need your books for all of these, assignments, quizzes, and your exams.
We have multiple attempt for the exam?
No, never mind, one attempt, sorry. Thank you. So, multiple attempts for your quizzes?
Yeah, quizzes are 2.
Quizzes?
Assignments, just not the exam.
Quizzes, you have 2 attempts, exams, you have 1, and your assignments, you have 3. Okay, so 3, 2, 1. Again, have your books handy, everyone has their books, right?
Yes.
Okay, so there shouldn't be any excuse any longer. Like I said, do not wait until the last minute. I will do my best to add a supplemental to finish up chapter 2, but other than that, finish chapter 1, start and finish chapter 2. Next week, we're gonna start chapter 3. Okay? Any other questions? Good luck, guys.
So we're not gonna need the yellow book anymore after this?
No.
Nope.
I would still keep it in your car.
Ah, okay.